Most women who get screened for breast and cervical cancer through Minnesota's SAGE program have normal results. But what happens when they don't? When their test results come back abnormal? SAGE and its network of clinics can help. Minnesota's SAGE program was created to keep women healthy and to make sure they get the care they need. Funded by the nation's Centers for Disease Control and Prevention, SAGE is required by law to make sure that women get necessary follow-up services after abnormal screening results. So, what exactly does the law require? When women receive abnormal results, clinics must ensure they receive needed follow-up services for diagnostic testing and treatment. This often means connecting them with specialists and, if they're uninsured, with MABC, the state's special Medicaid program for treating breast and cervical cancers. And once a woman is diagnosed with cancer through SAGE, a new set of deadlines kicks in. After a finding of invasive breast or cervical cancer, treatment should begin within 60 days. Treatment for cervical dysplasia should begin within 90 days. Usually, we can do even better. SAGE tries to make sure that women who need treatment get started within 60 days. The follow-up process is triggered whenever SAGE receives an abnormal result. That's where a new set of forms comes in. SAGE sends them to the clinics to guide the process and ensure complete reporting. Clinics should use the abnormal breast screening follow-up report to record dates and results of follow-up services performed. Clinics should fill it out and email or fax it to the follow-up coordinator at SAGE. The abnormal cervical screening follow-up form is handled in the same way. Complete it with details, dates, and results of the follow-up services. Fax or email it to SAGE's follow-up coordinator. If questions arise as you navigate the follow-up process, you can find more detailed instructions on the back of each form. The SAGE follow-up coordinator is also available to help assist as you guide patients through the diagnostic process. And what happens once a woman has a confirmed cancer diagnosis? That's when she needs our support the most. Even women who have insurance need help, and the SAGE system is set up to provide it. Often, insurers won't cover care costs until large deductibles are met. So clinics in the SAGE network bill a patient's insurance first, even if they know the insurance won't pay. The clinic then bills SAGE, which pays the cost of screening and diagnostic services, and thus helps to pay down the patient's deductible, moving her closer to fulfilling it. This helps ease the financial burden of cancer treatment. Women who have no health insurance who need treatment for breast or cervical cancer or precancer may qualify for Minnesota's Medical Assistance for Women with Breast or Cervical Cancer, MABC for short. It's a wonderful resource and covers all care costs. MABC was created in 2000 when the SAGE program's funders at the CDC realized that cancer prevention efforts won't succeed if women found to have cancer can't afford treatment. The result was a federal law requiring every state to provide a treatment resource for these women. Minnesota's answer is MABC, which covers all costs for medical treatment for low-income women diagnosed with cancer through SAGE. MABC covers Minnesota residents under age 65 who need treatment or staging services for cancer or precancer and who have no creditable insurance. It's available only for women with incomes below 250% of the federal poverty level who are not otherwise eligible for regular medical assistance. Women who need MABC coverage must apply and must renew their application yearly. Clinics can help women screen through the SAGE program through the application process, and the SAGE staff is always available to help. Some clinics can also grant presumptive eligibility to temporary medical assistance through the MABC program to women who need treatment right away. Temporary coverage can be granted regardless of a patient's immigration or citizenship status. It's a short-term solution that covers treatment only for 2 months, but it's an important tool in fulfilling our shared dream to protect all Minnesota women from breast and cervical cancer. Thanks for helping to bring this dream to life.